Hello everyone and welcome to a new video, and today I'd like to talk about a very interesting topic, and it's about how exercise can affect women. So if you're a woman, please watch this video. It outlines the benefits that exercise has and its potential for reducing premenstrual distress, for improving mood at different times during a woman's life, for example, during pregnancy, during postpartum, and even during menopause. So stay till the end of this video where I would like to outline the benefits that exercise has and talk briefly about actually what happens during each of these three stages. So in premenstrual syndrome, let's talk about that first. So after adolescence, hormone levels in women actually fluctuate. So in men, they actually remain constant, but not in women. Interesting. But exercise can actually help tone down the negative effects of these hormonal fluctuations or these hormonal imbalances. And exercise helps keeps the brain taut and flexible against these changes, which, as we saw in our last video, improves self-esteem, etc. This is very important because a woman can have around 400 to 500 cycles, and each lasts 4 to 7 days. So this is 9 years of a woman's life when she can experience distress. And of course, the symptoms vary from one woman to another. They vary greatly, but it's 9 years of a woman's life. So you want to make the most out of those years. And exercise can help a lot during these times when a woman can get irritable and have mood instability, etc. It turns out that 75% of women suffer from some type of distress, of premenstrual distress. This can be physical or emotional or both, and it definitely interferes with a woman's quality of life. What happens is the hypothalamus stimulates the pituitary gland to release gonadotropins, which are like hormones. And that stimulates the ovaries to make estrogen and progesterone, two key hormones, two crucial hormones that we'll talk about. So estrogen actually peaks 5 times before ovulation. So it's 5 times higher, its lowest level, right before ovulation. And then it, of course, goes up and down, it fluctuates. But it peaks right before ovulation and increases 50 times during pregnancy. That's crazy, huge increase. And declines in menopause. Okay? Progesterone, 10 times higher than the regular lowest level or baseline levels, not sure, but it's 10 times higher. I believe it's 10 times higher the lowest level that it gets to after ovulation. So where estrogen peaked 5 times highest level, where estrogen peaked 5 times higher its lowest level before ovulation, progesterone peaks 10 times higher its lowest level after ovulation, and 10 times higher during pregnancy. And just like estrogen, it plummets during menopause. And these hormonal changes trigger neurotransmitter imbalances, and a woman's reaction depends on her sensitivity to these changes. And I think this is really, really important. So you can see during menstruation and during menopause, there are these changes, as well as during pregnancy. So these are 3 important woman life stages where you get these hormonal changes, which in and of themselves cause neurotransmitter imbalances. And these imbalances can lead to the distress, etc. Okay? So what happens? Exercise, or these hormones make more receptors for serotonin and for dopamine, and estrogen even increases BDNF, which creates more serotonin. And so they regulate hormones, or they regulate neurotransmitters, right? So essentially these hormonal changes regulate neurotransmitters. These hormones, progesterone and estrogen, regulate dopamine, they regulate serotonin levels. Okay, so this is important to consider. Now, a 2004 study showed that those with premenstrual distress had an impaired ability to trap tryptophan, which is an amino acid, in the prefrontal cortex. And this led to less serotonin, which of course regulates mood and behavior, because tryptophan increases the level of serotonin in the brain via crossing the blood-brain barrier, as I alluded to in previous videos. And this lower level of serotonin, which regulates mood, makes women, of course, more pessimistic, less positive, less happy, and even leads to angry outbursts and aggressive behavior. In fact, another study on top of this 2004 study showed that even healthy women, that they don't have to have the premenstrual distress, but even depleting tryptophan in healthy women, okay, and this study was done in London, in King's College, I believe, caused more aggressive behavior. So just the depletion of tryptophan, which is what happens in premenstrual distress, leads to less serotonin in the brain, which leads to aggressive behavior during menstruation, during menstrual cycles in women. And this is important to consider, and it shows how these changes in hormones can lead to neurotransmitter imbalances, which lead to changes in mood and aggression. A 1992 study by James Blumenthal showed that he compared runners and people doing strength training, both cases 1 hour, 3 times a week, for example. And he showed that those in the aerobic group, so in the running group, they had benefits in terms of premenstrual symptoms that were even greater than the strength training people. Of course, strength training is great, especially in menopausal women, to prevent osteoporosis, and it has a lot of great benefits. But it's interesting, the runners group, the aerobics, had more benefits in terms of the premenstrual stress syndromes, and also more mental benefits. Runners actually improved in 18 of the 24 measures that they measured, like depression, as I mentioned, irritability, which makes sense based on what we talked about, the impaired ability to trap tryptophan, and also better concentration. As I mentioned, runners had better mental functions, even better than the strength training group, and obviously better than the placebo group. So it makes sense that the mood is better, less risk rates of depression because you get more serotonin, and of course many other reasons. We already saw the benefits of exercise in terms of depression, etc. And also, the people in the running group, the women in the running group, were less pessimistic and had a more positive outlook on life and had more interest in the world. So exercise may increase tryptophan and thus make more serotonin, as well as balance things like dopamine, which also is involved in mood and motivation, as we saw, norepinephrine, which could play a role in the concentration piece and the focus, and even BDNF, which is important for learning, as we saw. Exercise actually also helps balance GABA and glutamate and puts on the brakes to reduce over-accessibility in the brain, and which can lead to anxiety and panic attacks. But exercise balances the opposing forces. It makes more GABA, and GABA can put on the brakes on glutamate. It makes the right balance of GABA and glutamate, because if glutamate is too high, you get over-accessibility in the brain that can lead to anxiety and panic attacks. So exercise can also help that way and fine-tune the HPA axis, which is, as we saw, is involved in the stress response. So exercise can, of course, reduce the stress in this woman, reduce their anxiety and panic attacks during the menstrual phase, improve their concentration, improve their mood, reduce levels of depression, and even reduce irritability, angry outbursts, and aggressive behavior. What can you ask more for? And still, if 75% of women suffer from some sort of distress in their menstrual cycles, then exercise is probably the best for these women. And these are usually younger women than those in menopause. So these women, what the author recommends is exercising 5 times a week, and also having 2 days a week or a couple of days a week where they're doing heavy sprints or some more intense bursts of exercise, because it turns out that the more intense the exercise they do, the less irritable they are, the better the more stable their mood is, less anxiety and less depression. Exercise matters, but intensity matters as well. So you can see these studies which clearly show benefits in terms of depression, irritability, cognitive functions, as well as a plausible mechanism for the reason why women are have less depression and less aggressive behavior, because exercise helps increase the level of tryptophan as a plausible method, fine-tunes the HPA axis to reduce stress, and even creates the proper balance of GABA and glutamate. So exercise at least 5 days a week, whether it's running, whether it's whether it's something else aerobic, and have 2 days where you're doing something more intense, 2 or 3, several, a couple of days you're doing something more intense, because intensity does seem to matter, especially for the psycho-emotional symptoms such as anxiety, depression, and angry outbursts, for example. The next category of women that I want to talk about is pregnant women and postpartum women. So exercise is also very good for pregnancy, as what it does is it actually cuts abnormal glucose risk by half to prevent gestational diabetes. And women are less likely to have diabetes, and also the babies are less likely to be overweight, and you're less likely to cause longer carriages, etc. So to reduce the risk of gestational diabetes in these women populations, exercise is very good. And one study showed that brisk walking 5 hours a week can reduce the risk by 75%. By 75%, only brisk walking 5 hours a week. So that's like around, half an hour to 45 minutes of brisk walking a day, which is nothing. These women can definitely do that. And that can reduce the risk of gestational diabetes by a lot. Also, 20 minutes of pedaling was shown to raise endorphin levels and reduce labor contractions. So not only it's effective to reduce the risk of diabetes at that time for pregnant women, but it can also reduce the pain during labor. And when I say reduce the risk of gestational diabetes, I'm referring to the brisk walking 5 hours a week, whether you're doing it before labor, during labor, both are effective. Also, it's good against high blood pressure and something called preeclampsia, which I had to look that word up. And preeclampsia just involves high blood pressure along with liver and kidney damage. Not something a woman wants, obviously. And exercise helps reduce the risk. So not only diabetes, but also high blood pressure and liver and kidney disease. So clearly, exercising during this time, before and during, right? So exercising before pregnancy, right? Or before, right? When a woman is pregnant and before labor contractions is definitely beneficial. And yet 23% of women stop exercising when they're pregnant, and that's a mistake. Also, a 2007 study showed effects for mood. It's important for a mom to reduce her anxiety, depression, and stress levels, as those can influence the child negatively. Obviously, you guys probably already know that women who experience stress passes on those negative things to her baby, right? And babies that are born to more stressful, panicky mothers, anxious mothers, are less responsive, they're hard to soothe, they're clumsy, they're less adventurous, they're overreactive, and they have poor cognition. And exercise, of course, improves the learning and memory of the baby, increases BDNF, which is related to learning and memory, and even creates more cells in the hippocampus, which is also related to memory. So if you want your baby to focus and learn better and be better academically, then exercise is, of course, important. And so, of course, it's good for a mother's mood, and it's also good for the baby to make them more calmer, easier to soothe, less stressful, less panicky, and improving their learning as well. Exercise actually deepens the link between mom and the baby, giving them the nutrients and oxygen that they need, and improve brain development, learning, and IQ for the baby, as well as makes them more responsive and easier to calm down after sudden stimuli. For example, if there's a sudden light or noise or any other annoying stimuli, the baby calms down much faster if it was born to a woman that exercised. And this is important because essentially when you exercise, there's movements that take place that cause more muscle contractions and more oxygen and nutrients going to the baby, which is important for brain development, IQ down the line, better academic performance, learning due to BDNF during exercise, etc., etc. So exercising during pregnancy is very, very important for both reducing depression for mother, reducing diabetes, high blood pressure, etc., and of course reducing labor contractions, and also important for the baby in so many different ways. And the 2007 study, as I already mentioned, showed these effects for the mood also post labor. So if a woman, it prevents postpartum depression. So a woman who's walking, and the best type of exercise for a woman is walking her stroller, obviously, reduces the risk for depression, which is actually a lot higher postpartum. So again, great benefits postpartum to reduce depression, and great benefits during pregnancy for a woman to slash off the risk for pretty bad physical health conditions and reduce depression and create such amazing benefits for her child. Okay? And the last woman phase that I want to talk about is menopause. By the way, for pregnancy, how much exercise do you need, or for pregnancy and postpartum? Well, the author recommends simply brisk walking for 30 minutes every day of the week of moderate intensity. Of course, you don't want any contact sports because that can cause problems. And of course, you don't want any intense exercise during pregnancy, nothing too hard, but brisk walking is definitely a good option. And that can prevent high blood pressure, diabetes, organ damage, and even prevent cognitive issues in the infants, and improve their brain development and academic performance and IQ. And I can go on and on and on. Easier to soothe, they're more responsive, they're less hyper alert, they recover faster after a stressful or sudden stimuli. So exercise also if you're pregnant or if you already delivered a baby. And the last category is menopause. So menopause is one day. It's just one day that marks the end of 12 months after a woman's last period. So you have the woman's last period, and 12 months after, or a year after, that one day, we call it menopause. And the reason why we call it is because it's associated with hormonal it's called that because the menstrual cycles pause, they end. But what happens in menopause is, of course, the hormones plummet. They falter, they tail off. They pretty much go to a very, very low level. Pretty much these progesterone and estrogen stop being made. Their levels decline. And this can, of course, be associated with osteoporosis and when women lose the strength in their bones. But symptoms don't actually start in that one day. They happen in the women's around in the mid-40s and to mid-50s, with the average age when the symptoms start is around 51. So the symptoms of menopause start a couple years before. They start sooner. They start sooner than that menopause day, and they last for several years. So what are those symptoms? Things like hot flashes, night sweats, irritability, and mood instability. But exercise helps counter the negative effects of lower levels of these hormones and prevents cognitive decline that's associated with aging of a woman when these hormones decrease. And exercise helps the brain maintain itself for survival and tricking it despite diminishing hormonal cues. maybe this is something evolutionary, interesting, but these lowering hormones of progesterone and estrogen are like a hormonal cue that you're aging. And exercise tricks the brain that no, you're not aging. It gives us counter cues, counter signals to oppose this aging cues. And you can see how that will definitely help in terms of preventing cognitive decline and reducing the risk for cognitive disorders like Alzheimer's and dementia. Okay? Which are a sign of aging, of course. And 2002 statistics by the National Institute of Health show that HRT, hormone replacement therapy, which raises estrogen and progesterone, so you'd think by increasing those hormones, physical health conditions will decrease because older women are at higher risk for heart attacks, strokes, diabetes, cancer, much higher than premenstrual women, which pretty much never get heart attacks unless they're at higher risk due to diabetes and obesity. But due to the reduced level of estrogen and progesterone, that's when women usually, if they get it, they're way higher. Women don't get heart attacks when they're premenstrual. It's usually after menopause. And guess what hormone replacement therapy does? Is it increases this hormone. So 2002 statistics actually showed that these health conditions decrease after HRT? No. What it showed is that the risk for chronic health problems were even higher after hormone replacement therapy. Opposite of what you would predict. And after stopping HRT, after this crazy controversy in the world in 2002 because of these stats that they increased the risk of heart attacks, strokes, breast cancers, women stopped using them, and then 2 years later in 2004, statistics show that breast cancer rates dropped 9%. So when women stopped this HRT, you would think it would help, but it actually made things worse. When you stopped using it, it made things better. And people using HRT twice a week, even after, actually had double the risk for dementia. So best advice is to ask your doctor. It could be good for someone or not, depending on how sensitive you are to it, etc. Now, HRT does indeed work very well for the immediate symptoms of menopause. Remember I talked about the hot flashes and night sweats? You bet HRT will work for those two, and it will really help alleviate the symptoms. But exercise is way better down the line for heart disease, diabetes, breast cancer, and cognitive decline. For what we're talking about, for these health problems that are associated with aging, exercise is better. As we saw for cognitive decline, it tricks the brain, it sends counter cues, as well as for all of these other things. We already know the benefits for exercise, for hypertension, for all of those things. I guess it reduces the risk factors for heart disease, etc. So exercise does in fact help down the line for physical health conditions. And Lee Cohen actually showed that the risk for depression is 2 times higher when women approach menopause, as well as anxiety because of fluctuations in these hormones. But a study in Australia showed that 2 to 3 times a week of exercise can reduce the risk of depression and make women less tired. So remember I talked about the irritability and the mood instability piece? Well, exercise definitely helps that. So although HRT may be more effective for hot flashes and night sweats than exercise is more effective for the irritability and the mood instability piece, and much more effective for the health conditions down the line, like heart attacks, stroke, and cancer, and breast cancer, and I think and cognitive decline, which I think you care more about than the night sweats and the hot flashes, which will pass away anyways. But that's why I don't recommend the HRT, because although it helps these two things, it increases your risk based on the evidence for the other health problems down the line. Now, in terms of exercise, it hasn't really been shown to affect hot flashes and night sweats as much, but still, it's definitely effective for the other health problems that are associated with aging.